Thank you for joining me for this presentation on medical professional liability insurance, specifically tailored for midwives. Our goal today is to provide a comprehensive overview of what malpractice insurance covers and how you can protect yourself, whether you're employed, an independent practitioner, or running your own practice. We'll also review common causes of malpractice claims in midwifery and how these compare to claims involving physicians. So let's start by covering what you can expect to learn about during the session. By the end, you will have a clear understanding of what professional liability insurance covers and how it works, the most common causes of loss in midwifery claims and contributing factors, and how midwives can effectively safeguard their practice and their patients through adequate insurance coverage. So what is professional liability coverage? Well, in short, it's for when patients sue. Any patient who is dissatisfied with their care or who experiences an unexpected outcome may file a malpractice lawsuit. Specific legal elements must be present to establish professional liability, and those elements include a healthcare professional must have committed an act, error, or omission, and the act must deviate from accepted standards of medical practice, and the deviation must directly result in harm to the patient. Malpractice insurance is critical because it protects you financially and legally when claims arise. So let's do a bit of a coverage overview and talk about what professional liability policies insure. For TDC Group specifically, our policy covers things like limits of liability. And so that includes compensatory damages such as settlements, judgments, and awards. There's also coverage for defense costs. And really that means covering attorney fees and court expenses. And it's important to note those are paid in addition to the limits of liability, so they don't impact how much of the limits are actually available. There's also coverage for supplemental benefits, including reimbursement for time lost and expenses incurred during trial participation. There's also coverage for court costs and appeal bonds under the supplemental benefits portion as well. I often get asked, how do insurance companies determine the premium for a policy? Well, there's actually several factors in determining the annual policy premium. Insurance premiums are calculated based on factors such as specialty classification, hours worked, and that means whether you're full or part-time. And at TDC Group, we define part-time as being less than 20 hours a week. Geographic location is really important, as well as the policy limits that you choose. One other important factor is the type of policy. So there's generally two different policies available. Those are claims-made and occurrence-based policies, and we'll discuss the difference in the next slide. So claims-made is the most common type of policy, and the easiest way to understand it is that a covered event must occur on or after the first date of coverage. That's often called the retroactive date. And the claim must be reported during that policy period. Whereas with an occurrence policy, that's for any claim arising from an event during the policy period is covered. And so it's regardless of when that claim is reported. And a key thing to consider here is the need for quote unquote tail coverage, or what is more formally known as the extended reporting endorsement. And so if you have a claims-made policy that you let expire, the tail coverage will provide continued coverage of acts that are subsequently reported after that claims-made policy has expired. So what liability is covered in a medical malpractice policy? Well, for TDC Group, our policy language states specifically, we will pay on behalf of an insured those sums that said insured becomes legally obligated to pay as damages for claims covered by this policy. And there's a couple of caveats there. It's less any deductible, and obviously TDC Group will pay up to the limits of liability in the policy. But there are two key terms here that I think we should clearly understand. The first one is damages. And damages are really just the amount of money legally payable because of injury to which the insurance applies. And so examples could include attorney's fees to claimants, along with settlements, judgments, and awards that are determined by the court. The second term to understand is a claim. And that is really simply a demand for payment. In this case, the demand is usually for services caused by a professional services incident that is not excluded by the policy. Now that we spent a little time talking about liability, let's run through an example of how the limits of liability actually work on a policy. So one of our most commonly selected options is 1 million, 3 million. So what does that mean really? At first, that means a maximum of 1 million could be paid on any one individual claim. And then the second number means a maximum of 3 million could be paid for the entire policy year. This is also often referred to as the annual aggregate. It's important to note there is no limit to the number of claims. The limit is really on how much will be paid for the policy term. And one thing to keep in mind is that policy limits are generally purchased based on the clinician's comfort level, as well as the requirements from any sort of healthcare organization or health plan requirements. One portion of the policy that is often overlooked is the list of exclusions that could preclude coverage. We've listed a few of the notable ones here, but this list is by no means exhaustive. But some of these are fairly obvious, like sexual conduct, substance abuse, harmful acts, and civil rights violations, but there are a couple of the other ones that bear calling out as well. A big one is out of scope of practice. This is becoming more of a common issue as clinicians look to expand their duties without checking with their malpractice carriers to make sure that there's coverage for those expansion of duties. Another one is medical records alteration. Anything other than a legitimate corrections could lead to a claim potentially not being covered. Another area of best practice for clinicians and midwives is around the area of informed consent. So managing patient expectations through clear, documented communication can prevent misunderstandings that lead to lawsuits. Remember, informed consent is not just about securing a signature. It's about meaningful dialogue with patients. That discussion can include different care options, the risk and benefits of each option, along with any potential alternatives. It's also important that patients are given an opportunity to ask questions. Additionally, proper documentation is key. Altering records post-incident can compromise your defense and result in a policy cancellation. You always want to adhere to professional standards for record keeping. So far, we have discussed some important aspects of a medical professional liability policy. Now let's take a look at some of the claims data for midwives to better understand the types of losses that are actually experienced by practitioners. To start, let's look at some high-level data from the Doctors Company database, and then we'll get into more specific data. Over the last 12 years, 71% of midwifery claims involve clinical high-severity injuries. Common contributing factors include patient assessment issues, communication challenges, and technical performance areas. These factors emphasize the importance of meticulous documentation and communication to minimize liability risk. Comparatively, midwifery claims differ significantly from those involving physicians, highlighting unique challenges in the midwifery practice. First, we'll look at just the overall number of claims or case counts by individual years. And as you can see, we don't really experience a high number of claims involving midwives, with only 51 being reported from 2010 through 2021. It's important to note that this chart represents 51 events in which a midwife was noted to be responsible in a claim from these loss years. These are TDC group claims, although the midwife may or may not have been a TDC insured. Another important aspect of claims data is the actual claimant type. And so in those 51 events that we were talking about, the majority were actually inpatient, like in the labor and delivery room. However, some were in the patient's room, like for mismanagement of a postpartum patient. The ambulatory settings tend to focus on things like prenatal care, and then the one quote unquote other represents an event that happened in a birthing center. We can also identify claims by their location. And so this slide really is providing more information on where the malpractice event occurred. You can see that over half, about 55% of the claims happened in labor and delivery, while another third happened in an office setting. The locations on the remaining claims occurred in various locations, ranging from nurseries to the operating room to the ICU. Now, remember when we started out this claims discussion by saying that the majority of the claims were of a high severity. Here we'll get into that data a bit more. Unfortunately, fetal death accounts for almost 20% of the events, while maternal deaths account for another 12%. The other high severity claims, roughly about half of them are more around disabling injuries. And then if you look at the medium injury severity claims, they tend to be non-disabling and account for about 20% of the overall events. As we look at the major allegations with midwife claims, we can see that most of these focus on OB treatment. There are a few that fall into diagnosis-related allegations, and those events are diagnosis unrelated to a pregnancy. So for an example, it could be things like a missed breast cancer diagnosis. One of the strengths of our database is the ability to drill down into factors that lead to malpractice. We use an evidence-based taxonomy that you can see listed here to evaluate the events. Then each claim is reviewed by patient safety analysts who are specifically trained registered nurses. This slide illustrates the various categories and subcategories of the different contributing factors. We'll go into a little bit more detail on the next slide. So now you can visualize the even more detailed level of the taxonomy and how with this information, focused areas of risk management and patient safety tools could be used to help us improve outcomes. And so from what we saw on the previous slide under clinical judgment, our top two subcategories were selection and management of therapy and then patient assessment issues. With this level of detail, we can focus on those specific issues and we can view a detailed clinical summary of those cases with that issue. So for example, we can review those 26 events with selection and management of therapy and examine if there are similarities or themes that we can call out. Continuing on to look at other contributing factors, communication among providers with midwives is typically in situations where there's an OB attending, but there are some situations with communication among other nurses as well. So we've spent some time examining common causes of malpractice claims for midwives, but we also wanted to provide a comparison of those claims to physician data as well. The data we will see on the next slide is from Candelo. This data consists of inputs of about 20 different organizations that include everything from academic hospitals, community hospitals, and other medical malpractice insurers. The database is estimated to contain about a third of all medical malpractice claims in the US. So TDC Group at Candelo, we did a joint study in which we compared attending and midwife cases, specifically those with only OB allegations. Then we looked at the comparison of the top contributing factors in percentages, as you can see here on the slide. Well, what we found out really is there's not extreme differences. One area that did stand out is that we do see attendings with more technical performance issues, but we can explain that most likely with attendings doing C-sections. In communication among providers, this is likely because midwives had to discuss more with other attending physicians. And one thing to keep in mind is that this is a national database, so the scope of practice is going to differ a bit. As you have seen, TDC Group is well positioned to support the malpractice insurance needs of advanced practice clinicians. TDC Group now offers expanded coverage options for APCs, including midwives. These options include policies for independent contractors and practice owners, supplemental primary and excess coverage for employed practitioners, coverage for general and vicarious liability, ensuring comprehensive protection for all practice models. So just a couple of things to keep in mind when considering whether to purchase a professional liability insurance policy. If you're employed, the practice typically provides your coverage. However, you can still purchase a secondary or what we call a sleep easy policy or try to negotiate separate limits. If you're a contractor or practicing autonomously, there are two options to purchase coverage from TDC. You can go directly online through our website by visiting tdcg.com, or you can work through an agent and broker if you're more comfortable working with an insurance professional in that way. So at TDC Group, we're committed to advancing, protecting, and rewarding good medical practices. By investing in malpractice insurance, midwives can focus on delivering exceptional care with the confidence that they are protected. Thank you for your time today.